Now, it's believed that more than 100 people with learning disabilities and autism in Scotland are currently living in institutions such as hospitals.
And today, campaigners and relatives of young men detained across the country stood outside the Scottish Parliament calling for patients to be released to their homes. Our reporter Hope Webb went to meet them.
Locked in hospitals, left to rot! Locked in hospitals, left to rot!
These families want action. Their loved ones have been detained in hospitals for years. All of them have learning disabilities, autism or complex care needs. Their families say they're losing their human rights and their youth, stuck in a system they don't understand. One of those here today is Sylvia. Her son Jamie went into hospital in Ayrshire after a period of crisis at the age of 19. He's now 26. He's been cleared to leave twice, but a solution to bring him home hasn't yet been found.
He was just walking out there and he would be just the way he used to be. He would just be thriving most of the time in the community. But it's just not allowed. I have to keep telling him, sorry Jamie, we're working towards it. Mum's trying her best.
Renfrewshire Health and Social Care Partnership, which is responsible for Jamie's care, said it's been working with his family to find the right community support for him. It also said finding a solution was a priority and it will explore all options.
It's not right.
2 years ago, the Scottish Government pledged to bring a significant number of people like Jamie home by 2024. The Scottish Government says it's committed to reducing delayed discharges experienced by people with learning disabilities and complex care needs. It says it's working at pace, but planned changes will take time to deliver. But these families say time is what their children don't have. Hope Webb, BBC News.
So joining us now is the organiser of the protest, health and social care worker Alistair Minty. Alistair, is there a good reason for these young adults being in hospital in the first place, or is it just the delayed discharge that you have issues with?
Right, well, I guess the issue is that anybody can have an episode in their life when they are a crisis, whether it's their mental health or something else related to their disability. So we're not saying that people don't need to have a short period of time where they get a bit of assistance. The problem is that quite often what that ends up with is it doesn't end up being therapeutically valuable. The people end up getting institutionalised and getting additional diagnosis, and they end up getting over-medicated and they get locked into the cycle where they get blamed and they can't cope because they're away from everything that works for them.
And of course, a lot of them are in the position where medically they've been told that actually you can be discharged, but there's obviously a barrier to that happening. And is that due to just a lack of money? Is it local councils that have to foot the bill for community care?
Absolutely. There's a number of different scenarios, but quite commonly what we find is that people are deemed as being suitable to go out into the community, into their own homes, and either the staffing or the accommodation isn't there, and so people are held, and while they're being held, they get more and more frustrated at the circumstances they're in, and so their behaviour deteriorates, and then they can't then go out. So some really tragic stories.
What does this kind of institutionalisation do to people who are in hospital? I mean, as you've said, for maybe a short period, maybe it's a good thing that they're there, but on a long-term basis, what can the effects be?
So the effects can be psychological, emotional and physical. So for example, it doesn't just extend to the individual themselves, but the families and all those around them. So we've had people who don't self-harm at home, and they have gone in and ended up breaking bones, breaking teeth, getting diagnosed with epilepsy. So the level of frustration is quite palpable. And the problem is that we see this and we know that it's not working, but we just do more of it. So the hospital environment operates generally on power and control. So the problem is that when somebody doesn't comply, they get more medication, they get 2-to-1, 3-to-1, they get physically restrained. And that doesn't work. In the community where I've spent most of my practice, we work out ways of listening to people and engaging with them, and so that people don't feel they have to force us to listen. And most of the time it's for us to learn but we're expecting them to learn while in a hostile environment, and that just doesn't work.
What about the impact on the families? I mean, they must be at their wits' end, and I suspect, you tell me if I'm wrong here, that they might be tempted to try and get their sons and daughters out of hospital and care for them themselves, but maybe they're not equipped to do that by themselves.
Yeah, no, that's absolutely correct. What happens is that people get so frustrated, firstly, that they're not listened to. So the ideas that quite often the family are putting forward are valid ones, but from a risk point of view, a lot of the hospital situations will just say, we're not doing that. We just don't think that's safe. But often, if it's done correctly, it can be absolutely safe, a lot more safe than medicating people and holding them down. But as you say, as they get more frustrated, sometimes people will be more and more desperate, and then they can get blamed for saying, oh, well, you're contributing to the problem. But in my experience, most of the time, the families, if we listen to them early enough and support them, we will get far better results.
Scottish Government says it has a target, by next year to bring these numbers down substantially. Why isn't that happening yet?
So it's interesting because it's been a very positive report. We were very happy to see that coming out. The issue is, and it's like a lot of things with government, I guess, is the implementation of it. So the idea behind it is fine. In practice, there's some really great practice happens in some areas, and some people are very willing to welcome in external help and support. But for some people, they just say they know best, or they just say it's not possible. So they just get to ignore all that. And what we are saying now is that absolutely that can't continue. This is 2023 in Scotland. Everybody deserves to be treated in this way. And this sort of mindset that power and control is the way forward is like 40 years out of date.
OK, Alison Minty, thank you very much indeed for joining us.
Thank you.